So we got hopefully quite a lively panel talking about something which is building on the themes that we've had from our great headline speakers, and Jordan is with us today to join us. But we want to make it reasonably interactive because we want our panel members to really engage with it. Then we'll open it up to the floor. We'll go with the flow, see how it goes. But be prepared because we want to talk about issues which are to do with the health of the nation, the working age population of the nation, and whether we're doing the right things to keep people in work potentially longer than they are now. Are we doing the right things? So that's what we want to touch on to see whether our innovation and our research is really contributing to the UK economy in the best way it can do. Okay? So, in our panel, my name is Paddy Bradley, I'm the chair of the panel. I'm a board member of the Health Innovation West of England, and I'm like from the industrial side. I know nothing about the health service, other than what I pick up on the board. I don't come from that background. I come from a different background. I used to be the chief executive of the Swindon and Wiltshire Local Enterprise Partnership, and I've done various roles in local government and private sector. And we join with a really great panel of people who've got all sorts of different perspectives. That's what's going to make it so good, because we're not all coming from the same angle. Okay, so start off. Jordan, can you introduce yourself first of all?
Yeah, hello. Oh,
Pass it along.
is that better? Hello, see you again. I'm Jordan, I work for the CBI. Most of my job is talking to government about what business needs. I come at this from a couple of angles, from the traditional business investment angle. What do we need to do as local or national government to get more people investing, to let us grow, to people to buy buildings and tractors and whatever it may be. The other angle is that I started the CBI's first health team a few years ago. For 56 years, the biggest business lobby in the country hadn't dared talk to anyone in the healthcare sector beyond just drugs are too expensive to get into the NHS. And so after the pandemic, we started a big programme of work with NHS England to take employers en masse a bit further into the prevention space. So I come at this from a business investment angle, but also with a personal passion for getting industry en masse, and that's everyone from baristas up to BP, a bit more interested in health.
Joe.
Hi everyone, I'm Joanne Medhurst. I'm the Chief Medical Officer of Bristol, North Somerset and South Gloucestershire, now to be called BNSSG. Just to let you know my background, I am a GP by a professional background. I've been around commissioning since the days of fund holding, which shows my age. So I've been around in commissioning, also been a medical director of a large London community trust. So I've been both a provider and a commissioner across my career. I've also done work in the change space. I was very privileged many years ago to work with Don Berwick in the primary thing called the Primary Care Collaborative, which is about improvement in general practice, which is still, I've got to say, relevant and resonant today. But I've also been lucky enough to be sponsored by the Health Foundation, so I'm a Health Foundation Fellow. So change and iterative change is a part of the work I do. In the ICB, there are two clinical representations on the board, the Chief Medical Officer and the Chief Nursing Officer. And our role is to engage across all of the health and care professionals, including the sort of practitioners in the life sciences, to represent that clinical voice in the decisions we make, the spend we allocate, and to do some advocacy and strategic thinking around what the future might look like, how we modernise and how we might shift to deliver the roles that we needed. The Chief Medical Officer role in particular focuses on health inequalities, health equity and population health. So that sits on my portfolio to make sure that we look at what we're doing is addressing the marmot, talk about the wider determinants and the health inequalities which have been structurally bound in to our system to date.
Brilliant, thank you, Joe. Thanks so much indeed. Chris, you got one.
Yeah, we'll see if this works. It works. Good. Hi there, good afternoon everyone. I'm Chris Molloy, Chief Executive of the Medicines Discovery Catapult. For those of you who don't know what catapults are, they are national centres for translation and innovation for individual sectors. We have 9 of them across the UK. I'm in Medicines Discovery, covering medicines and diagnostics. Our job is to run big national programs. Okay, that's fine. Our job also is, and more importantly, is to de-risk young companies and make them fit to fund, to de-risk productive new technologies and drive their adoption into systems that we care about. During the pandemic, I had the privilege of starting and running the Lighthouse Labs that did all the PCR testing, 98% of it, across the nation, and driving a UK supply chain of innovation to make UK-derived lateral flow tests, which we did during that time. So fell in love with diagnostics in the home, in the high street, and how it changes health and changes our opportunity. I chair a couple of UK biotech companies, but also chair the industry advisory board for the Greater Manchester Biomedical Research Centre. So pulling industry in to make sure that these things are co-developed with industry. Industry isn't the afterthought, the checkbox right at the end of the process. It's right at the beginning. So I'm looking forward to engaging in all of that and seeing where government's role is to help industry, serve industry, so it can serve the nation.
Great. Thank you, Chris. Afternoon. Peter Allen. I'm the General Manager of a company called Pharmaxo. I've got about 40 years of manufacturing experience behind me and 25 years within the pharmaceutical manufacturing sector. And most of that 25 years has been in leading CDMOs, so contract manufacturing organisations. More recently, 11 years with Catapult. People can say, who the hell are they? If you go up and down the M4, you'll see a very, very large facility in Swindon just to the side there, which was proudly flying a large Union Jack. I'm responsible for the Union Jack, by the way.
Not the building, just the
not
flag.
The building. That's one of the facilities. And I think in more recent times, claim to fame, apart from many global blockbuster products which we've managed to formulate and to scale up and to commercialise for small enterprises in an innovative space. We were also right at the very forefront of the global endeavours to save humanity for COVID. So it was Catalan who made Moderna's, Janssen's, Pfizer's, J&J's, AZ's COVID vaccine, and Catalan made in excess of 2 billion COVID vaccines, and they were first to market in December 2020. I think it was 2020,
yeah.
when Vice President Pence came to actually visit the facility in Bloomington to congratulate, and we also endured the joys of having the Italian authorities strolling into our Anagni factory down there near Rome, insisting that the Italians were the first to be served for the vaccines.
Brilliant, Peter. If you want to hold on to that, we could make use of it. Okay, thanks so much indeed. So that's our panel, and you can see from that we've got quite a range of interests, quite a range of people from different backgrounds. Okay, just to set the scene, I just want to give you a few figures to think about, because we're talking about, first of all, there's one heck of a lot of money in this, one heck of a lot of money. So you take the UK budget, the UK government spend, round about 20% of it goes on health in its widest sense. 20% of a 1.2 trillion budget. When you think about the NHS, it employs about 1 in 17 people in this country at the moment. And it's forecast to grow to 1 in 11, with about, currently after the budget, I think with a budget of about 192 billion, not including capital. So we talk about whacking amounts of money. But when you look at the population, the working age population of this country, there's 8.9 million people out of that working age population, 16 to 64, who are claiming health inequality benefits. Some of whom might be working to some extent, the majority are not. That's about 20% of the working age population. And if you look at some figures to see what's happened in those figures, since COVID, there's been a 30% growth in the number of people not working, who are of working age, who are not working. When you compare that UK performance with other countries who similarly keep those records, 30% growth, the nearest country is Denmark with 13%. Before COVID, there was round about 4,500 people under the age of 40 who are claiming benefit per month. It's now 11,500 per month. So there's a significant growth, and there may be some issue about that age range as well, the younger age range. There's certainly an increase in mental health figures. It's quite difficult to get a size of what those figures are. So what's the solution to this? What do we need to do? And when you look at the life sciences sector, there's quite a drive to get a life sciences sector in the west of England. And the west of England has 3rd place in the country for its growth and employment in the life sciences sector. I wonder if you can guess which is number 1. Any guesses? Number 1? Go on, stick your finger up, have a go. Number 1, which area of the country do you think it might be? Go on, Steve.
South East London?
No.
Manchester?
No.
Scotland.
No, it's where I actually come from. It's Tees Valley. But it's the growth and employment, not the numbers. And the growth in the Tees Valley is around about 82%. 82%, but from a low base. Which is second, though? Go on then.
Oh, it's cheating, isn't it?
Yeah. Swindon and Wiltshire. Swindon and Wiltshire is second. Now, let's think about that. There's quite a drive to have a life sciences cluster in the west of England, which actually doesn't include Swindon and Wiltshire. But if you did include it, because it's within the footprint of the Health Innovation Network, you've got 2 of the fastest growing areas in the country for growth and employment in the life sciences. So we've got to think about that. Do you want a question? Is that a question?
No, I was just reflecting, actually, you're probably showing my age, but like Joe, obviously ran in fund holding days, and I'm a clinician by background, and I can just remember in the 90s when I first qualified, there was a really great scheme, and I'm just thinking about the pipeline, about where's the workforce going to come from, and we know that, you know, children are less choosing the sciences to study at GCSE and A-level, and there was and I can't remember what it was now, but actually, there was a bit of a campaign. It was called Take Your Daughters to Work, but it wasn't.
Oh, yes, yeah, I remember that one.
But actually, I had school children joining me in clinic, treating patients. But actually, there was something there that sparked an interest before they even chose that. And I just think some of it, we need to start these conversations before people choose what subjects they're going to study to enthuse them about going into life sciences. Because I think that's our pipeline, that's where I work for. So some of it could be just really practical things about, you know, studying and enjoying and seeing that there are job opportunities at the end of those studies.
Absolutely. Very, very good question. You weren't planted in the audience, but it's very helpful. Very helpful for when we talk about, because we do need to talk about long-term solutions, and maybe this country isn't that good at doing long-term solutions. We tend to be a little bit political cycle-based, which is problematic if we want to really be in that competitive position. Just the last thing I want to do is on an intro, just to get you thinking about, you know, there's the green paper at the moment about the industrial strategy. That has life sciences as one of the 8 areas of growth that we need to look at. And the mayors and combined authorities, and there's a mayor of West of England, have that additional power. They've got to produce a 10-year growth, local economic growth plan. It's going to come out in the areas there. So we have a policy approach which is going to help us. The issue is, can we take advantage of it, or will we be competing like crazy with everybody else? And we're not a very big country, really. Okay, right. So let's get started on the thing. So that's the scene setting. Now, each of these people have got great things to talk about. And we heard Jordan this morning, an excellent speech, Jordan. Thank you very much indeed. So, crucial, let's go straight to it. What strategy do you think would be a good one that we should be taking to keep people in work for longer?
Well, I mean, look, from our perspective, I really mean it when I think that industry has a reach that only government could dream of. And I really mean it when I say frontline is a very loaded term, but I really mean that when I say that industry is the new kind of prevention frontline. As much as you might argue with the terms, I really just think that the depth and the regularity with which you can see industry gives them a role to play that they've not played already. The challenge with business is, if you speak to business leaders, they will say, number one, I don't have any time or money if I'm too small. Number two, we've got loads of other frameworks and reporting to do. Number 3, the middle 40 years is the bit we can influence. I can't really do a lot until they get into the workforce, and I can't really do a lot once they've retired by and large. And so, similar to the climate debate, the joy of scoping things and the joy of having frameworks is you get very clear very fast in your role within the system change. And so, for me, I think if you talk about the working age population, there's loads of treatments and drugs and things that the NHS itself can do. There's loads of things when you tip over into care that we need to do, and that's fine. But if you are really serious about not feeding the funnel at the rate that we've been feeding it in the last few years, you're going to need to get more employers at every single level to bake this into their strategic planning, into their corporate reporting to some degree, and you're going to need to help them with incentivisation and tax breaks for the provision they will require for the staff that they have. Because otherwise, I can guarantee it, and we've seen it in climate, if they don't have to pay for something, they simply won't do it. And so the incentivisation bit for us is really important. It's what we've been working with Treasury on around OC Health and tax-free benefits. Now, you're never going to get a system that has an NHS to kind of make private healthcare tax-free. That's a bigger challenge. But there are lots of tactical things, I think, that we can do through the budget to make it better. But as I mentioned before, that is just one part of it. It's going to be really difficult to get a one-man band, a barista, like I mentioned before, to think a little bit more about how much they help population health. And so the reporting framework for me is really important. When we were doing this on climate, there was a guy called Nick Stern who did the Stern report into carbon. We don't have a health version of the Stern report. The CBI tried to set something up with a lot of bodies, including HF and lots of others a few years ago. But you all know better than me, the healthcare space is very disparate. And so getting the right people to feel like we can get it on the Prime Minister's desk was hard. So long story short, I think for us, the middle 40 years is the bit where business feels like they've got skin in the game, which feels fair enough. If we incentivise people and lower the tax burden to increase the level of provision across the private sector, that surely has to help. We can get onto metrics and efficacy of that in a separate discussion. And then I feel really, really strongly that at national strategic level, you need a 1.5 degrees equivalent for health, whether or not it's based on inactivity or whatever it might be. For me, I think healthy working life expectancy has got to be the place you start. And tying that a bit more proactively to the pension age will make people across government departments wake up, because I don't think people have got this growing gap that is coming at the end of the working life. So that's where I start.
I think I agree with all of that. I was thinking from my very narrow health perspective. I've been, I went to medical school, got straight out of school. Actually, the involvement with the business sector, as we had a briefing for this, it was like a real light bulb moment. I'm thinking, we need to deliver prevention. In the ICB at the moment, I've got some strategy leads in the group. We're looking at how do we respond to the 2040 gap. And actually, it has really resonated with me that you see your workforce and maybe the left shift prevention agenda is a shared agenda, it's not a health agenda. So I think it's something really interesting in that. From the health service perspective, we very much sit in the here and now. Winter is coming, we're focused on winter, it's urgent and emergency care, policies, metrics, they're all aligned into that UEC space, how many ambulances are queuing, what the weights are. And that is right, because people get harmed there. But we've also got to make equally compelling the story that by 2040, people will be living longer, but living longer in ill health, and the workforce that we have to manage that is significantly, we don't have it. Even for everyone in the South West went to the health service, we've got a divergent gap. We've got to make that narrative real to people, because it's only I'm going to be old at that point. I want a service that has been redesigned, whether it's use of tech, different workforce solutions, shifting care around into different places, commissioning differently. What are those solutions that we need to get into? Because otherwise we are yet again sleepwalking into not a disaster, but a series of issues that we know are there. I was around in the 90s when the King's Fund talked about the demographic time bomb. Do you remember telling us that we were going to have a huge increase in the rate of people over 75? Well, guess what? Here we are. And guess what? The health service hasn't responded. We haven't designed for it, and so therefore we aren't fulfilling the needs. And so we're reacting in the here and now to all of the bits of issues that pop up on a day-to-day basis. We've got to get out of that. We've got to think more holistically, strategically, And although I heard the health and quality group does about co-design is broader than the clinician and the patient and the hospital system. It is the whole of the society that we live in place, and we've got to think about that more broadly.
Great, excellent, thank you very much. Peter, as an employer, would you be interested in sort of contributing to the understanding the health of your employees?
It's very interesting. What I was reflecting there was that we're kind of blessed to be in this space in terms of the pharmaceutical manufacturing space, because it's really, really easy to attach relevance to what the individuals who come into work actually do. So there's a huge amount of empathy and understanding that there's a final quality controller at the end of the day who's going to take our product, which is the patient. As a consequence, we have probably industry-leading absence rates, circa 2.5%, which is incredible. Our retention rates, attrition is very, very low. And it's all these sort of things which basically, it's a fortunate space to be in. But along with that is the culture which you develop to encourage engagement, and that makes for a happy workforce, and as a consequence, we have low levels of mental health, all of those things. So it's like a healthy workforce is a happy workforce, and more to the point, a happy workforce is a healthy workforce. And again, just applying that relevance really, really helps. And I appreciate that there's going to be a whole load of other sectors which are very, very difficult to maintain that engagement, potentially sort of retail, hospitality, where it's relatively low remuneration. We're not a particularly high-paying organisation ourselves, to be quite honest, so I'd almost counter that argument and say it's actually not down to the money, it's down to the relevance. And just picking up on the point that Emma made, around sort of education and feeding things in. One of the things we've done very successfully historically is a big reach out into the community, inviting local schools, colleges to come in. Catapult was an anchor organisation for the Swindon College to get their
University status.
University status, yeah, absolutely. And seeing the little sparkling eyes of the young children coming in when they're seeing a little bit of an experiment with dipping flowers into liquid nitrogen and shattering things and things of that nature, it does prompt people to think. And we've had some great student placements for people doing biomedical science and other science degrees who suddenly realise that actually maybe just health care per se isn't necessarily for them, but the life sciences industry absolutely is, and they get tickled by the opportunity to get involved in development and formulation, analytical development, formulation, things of that nature. So it's literally, it's the environment which you nurture and the culture which you nurture, which I think is really, really key.
Great, thanks. Chris?
When Beveridge did his report in 1942, he did it for a very different demographic and designed the NHS to look after fundamentally children and, unfortunately, men of working age, right? Which puts it in its time, actually. It's a long time ago. If we're going to do Beveridge 2 now, we're not going to do it to the patient. We're going to do it with the patient. That's the force multiplier here. It's the 67 million people who are part of their own health service, and it's not someone else's problem. It's not your problem to fix me, whatever I choose to do to myself. And in delivering some of those changes, allowing people to take some responsibility for their own health and awareness of their own health at an early stage, which can be done fiscally, it can be done with other mechanisms of, do you move to the further in the queue if you comply, or further back in the queue if you don't? You engage the population in its own health. You supply them with the tools that enable them to do that. So diagnostics in the home, in the high street. We got 67 million people to test themselves without having to ask a clinician for permission to do that, and to look after those that they loved. And then after COVID, we said, oh no, that was then and this is now. It's not. That was the Rubicon crossed. And there are in that area of healthcare outside the existing walls of the NHS, there are opportunities for industry to co-develop and co-deliver It's anathema to some, but absolutely necessary in my belief. Also, there are new industries which will be created by doing that. So we're not fighting the last war, we're fighting the next one. Our innovation is coming up with new things, not just trying to make the old things a little bit more efficient. So there's a role for industry to play in looking after its workforce. There's a role for industry to play in coming up with new tools and technologies which must be allowed in by a health system that has a lot of the tropes of a nationalised industry, which is, we've got this, until we don't. And so I think there are changes that can be made. Industry can come in to share that burden, so the NHS has got time to do what the NHS does best, not to try and do that and everything else. It's multiple roles for industry to look after their own health and to create new industries for our common health.
Brilliant, great stuff. Okay, just out of interest, as you're a business, you have to report on your environmental, social issues, so your performance in that areas. I just wonder whether, if you brought health in, how that might go down.
We're starting to talk about the well-being economy, really, and that sort of shift. And is there something about organisations being properly purpose-driven organisations that contribute positively to all of our stakeholders, not detract value away from them?
Yeah, it's a difficult one, that, isn't it, in the economy we have, because of the way companies are structured. But I think it's the right debate to have about how we need to do, because it's looking at the longer term impact of these different things, and do we need some form of structural change? Yeah.
I think it's interesting you're talking about 1/17 of the UK population working for the NHS. I can't think of an institution that has more inaccessible occupational health, that has more patients doing shift work, which is inherently bad for their health, which have poor food availability. I mean, it's an absolute textbook example of how not to treat your staff, and it's the biggest employer. And I think it's really interesting that I feel like we're kind of not seeing the wood for the trees, and that actually, what a brilliant place to do this.
Yeah.
Can I give you?
Come back on.
So I want to pick up on that point, on your point, because I was thinking about also the narrative we've got at the moment, the broken NHS. I've heard people say, well, everyone's tired, we're so tired. Where's it gone when actually the joy that you have from being a clinician? I've really, 40 years I've been a doctor. It is a real privilege. And we've got to tell these stories. I'm not saying it's not difficult. The work is difficult and it is hard and it can be traumatic. But most of the work is rewarding, you get social purpose as an individual, you do moral good. There's a huge narrative of positivity that we can describe that would encourage people to come and work with us. And if we could just sort out the vending machines and the food, and remember that we are all humans within that. There is a tendency in the NHS to dehumanise its workforce. We've got to recognise them as human beings with needs and requirements. So we did those both things, both points, we brought that together. I think very quickly we could shift it to be the place to want to come and work. And if we are going to manage the 2040 demand, we need people to do that, so that it covers both those points. Jordan,
Can I just say, there's no single data set in the UK for the average offer in the private sector for private sector staff, right? So if you want an average sense of what the workforce benefit provision is across the entirety of the private sector, that data genuinely doesn't exist. And so a few years ago, we launched something called the Work Health Index, which Amanda Pritchard came and launched for us, and it was fantastic. One of her commitments was, I'm going to do this for NHS staff. And then she said, well, I've got to give it to the trust, I've got to ask them, and then it kind of slowly disintegrated. But the point we were trying to make is, in the private sector, to get people to move en masse, it sounds really bad, but it's a market, right? You've got to gamify some of this stuff. People will do it if they know they're losing at it already and they want to get better. We don't have to do that in the public sector, but if you speak to people who work in the MOJ or DH or whatever government department, they will say HR is inaccessible, I don't know where to raise complaints. And so the NHS is at the worst end of it, but our public services aren't fantastic at internal stuff that the private sector has to be good at, otherwise their shareholders in the market will revolt because they are not. And to your point about corporate reporting, B Corps have been doing this for years, but that can sometimes be expensive and lengthy. We already have Section 172 statements for firms, which is supposed to account for some of those things that you were talking about. That could be expanded. ESG, I think, is potentially on the verge of death, but if it was going to stay, you might be able to make it ESHG. So there are structural things to do, but I completely agree, because the data sets are the challenge. If you're going to gamify this to move people, which you absolutely have to do, we had to do it on climate and we'll continue to have to do it on health, they will need a common framework. And so that standard, I think, is something we need to get back to.
Yep. So, okay, so in terms of the where to move from there, what's going to get us through from this situation? Now, we often rely on a government policy or a government strategy to get going. So let's look at the one that's coming up, which is the industrial strategy. Let's think about that, about what it might do. And life sciences is one of the 8 growth sectors in the country. And we need to pick up on that. We need to do it. There's quite a drive to have a life sciences cluster in this area. We need to do it. What's the general thought? What should we be doing? How do we get a balance between what we might want to do in this area and what's good for the country? Are we going to be overly competitive without thinking of our place in the country? So, any views from anybody here in the audience or on the panel? Who wants to speak up? Chris, you have a go.
Differentiation is really important when you're thinking about place. And I see in talking with metro mayors and people around the country, everyone says, we must be in drug discovery, everyone wants to be in it, and therefore you get this slew of everything, everywhere, all the time. Whereas actually there are areas of the nation that can really concentrate down on something like diagnostics, like medical technologies and others, to differentiate. And that makes a huge difference. One, you get known for a thing. Secondly, if you're thinking about international markets, where the message is even mistier from the UK, then you get known for a thing, rather than trying to pretend to do everything, everywhere, all the time. And I see this with the biomedical research centres and others, where frankly, if you took the logo off the top of the application, you probably couldn't tell which area of the country it came from. Because everyone says, we do this and we do that and we look after that and that and that, we do this, and just in case we've forgotten one, we also do something, and we've got 3 people doing that. Come on, focus on something that you really do well and absolutely nail it, and build your cluster around that. Because if you do that, yes, there will be a few people who say, what about my thing? But frankly, if you're looking at a region, you've got to differentiate, you've got to cluster around stuff that actually allows you to concentrate talent, concentrate the movement of money, concentrate the message to industry and elsewhere to engage in. So I think for the metro mayors, my message is always differentiate. Choose what you're going to do and choose what you're not going to do.
Great. Excellent. Steve?
Yeah, completely support that. The danger of the new industrial strategy approach, everybody will try and chase the same balls. Why? Well, because the government's already identified the growth areas that it thinks are important. So not surprisingly, everybody plays that game. If we do that, we'll end up with blancmange. Everybody will look the same. It will be tasteless. It will be useless. And I think people in this room have to fight hard. Certainly for us in this part of the world at the moment, the thinking is not about life sciences, actually, at all. Now, we think that there is, and it's very focused, and that's the opportunity. The danger is that what we'll do is we'll invent what we've had in the past. So we'll stick to the industry sectors that are already there, and that are, frankly, maybe going to be the ones that struggle going forward. So the more voices that are pushing for us to prioritise and be really focused and be the best in that space will be the win. A colleague of mine used to say, if you can't see it from the moon, it's not that obvious, don't bother. Because it's going to be a competitive game that we're moving into, both across the regions, but then a view from government, which will be the whole nation. How does the whole UK prosper as a result of this and beyond? So I'm with you all the way.
Good. Anybody else from the... yes, certainly, yes.
I think coming from a global life sciences corporation,
yeah.
I think one of the first things that we see is that there needs to be a common language. So, for instance, when you talk about diagnostics means it's so broad, and it can mean many different things to different people. Same as med tech, different from digital health. And I think that's, people talk digital health, I think in EPR, but it's so much more. So I think there needs to be that definition piece so that people really do understand what you mean when you're saying we're focusing on that. And I think from our point of view, and this is something we're looking at the moment, is can we bid for global headquarters in the UK for digital health? And for us, digital health means patient-facing, efficiency system-facing, healthcare-facing. What we're looking for is, have you got your skilled workforce there that you can pull on? And I think the really important thing is, have you got that joined up? And I think it was interesting where you were talking about the West of England has actually got a proper ecosystem and relationship, because it's no good being able to do stuff and then you find that, for whatever reason, the NHS systems are not in a position to partner with you, or the universities aren't there to do evaluations and pull it all together. And I think that's what you need, is that you need to have that clear definition, but that really great system that is properly working together, and then it becomes really, really attractive.
I wonder if it's, just on that point, I just wonder whether it's a little bit about reaching a point without trying to get a complete solution. You get to a point with something and get it going and get it kicking off and amending, and then you have to actually almost create a market for change. And the NHS has got to change as a result of it. If it's not, and certainly also businesses and universities might have to change if they're not going to get in on the act. Because if you create something, it can go anywhere. It's not stuck in this area. Just one quick thing, and then.
So the question is, would it be a good idea to have a cluster? In the west of England? Well, 100% was my answer to that, totally and utterly. And look, I think to Steve's point, in terms of sort of analogy of games and things, everybody knows that playground football means that the whole school runs around after the ball, and they're all clustered around it, and there's absolutely no structure, nobody's in position, not like in rugby where you've got your three quarters perfectly lined up, nobody steps out of their position. And in reality, when it comes down to creating a cluster,
Wales.
apologies to Bristol Bears supporters, they're on the Buffalo, so there we go. But if you actually look at what is probably required, it is that structure. So a cluster. Okay, a cluster. What is a cluster? Is it a congregation of lots of things which are very, very similar, or is it a carefully thought out, which has been influenced potentially by a successful cluster already, in terms of a carefully thought out group of organisations with synergies and adjacencies which can actually support each other? One of the statistics we were talking about a little bit earlier on is something like 60% of SMEs only have 5 employees, and that's in the biotech space. So there's an awful lot of people with a lot of brains, but unfortunately they don't have the brawn, they don't have the muscle to actually take the innovation and the thoughts on to the next level, to actually get to a point that you actually can commercialise anything. So I think with the educational establishments which you've got in and around Bristol Bath, with School of Pharmacy in Bath, Med School in Bristol, HIWE, Biomedical Science, all of these sort of things, it's potentially feeding employees into those organisations, which has always been a massive, massive problem for Swindon. For Swindon, not being a university town, lots of people who grow up through secondary education, then go off to university in Kelsey, they don't come back to Swindon. They stay off at the university towns where they've studied and they get employed there. So there's always been like a brain drain, and it's always been an incredibly difficult task to actually entice people in with science disciplines and backgrounds to come to work in the Swindon area. Even though Swindon and the Greater Wiltshire area is the 8th largest pharma and life sciences sector in the UK, and the 3rd fastest conurbation. So I mean, if they can do it in Swindon, hell, we can do it in Bristol and Bath without a shadow of a doubt. But it's basically offering something as a cluster, which is actually wanted, as opposed to somebody who thinks that it's a good idea. We need something which is actually going to literally follow the molecule from that initial concept, in terms of somebody with all the pharmacovigilance and understanding of all of the physiology, understanding what a chemical entity could actually potentially do in terms of delivering a benefit to a patient, taking that to something which is actually in a box, which somebody can pop the pill out of the blister pack, which is a long 2.5, 3 year, multi-million-pound journey. What I would challenge back to government is, okay, industrial strategy, yeah, great, love it, Clusters, yeah, great, but set yourself a target and an objective. Set yourself a target and objective to get one single product which has got MHRA approval before the FDA.
Very quickly.
Yeah, I love a cliche. So culture eats strategy for breakfast, and I would say culture eats innovation for breakfast. There's no point having clusters doing great innovative work if the conditions that we're living in aren't prepared to receive it. So the talk we had earlier, we need to talk about, I think the leadership of this collaboration needs to come together. We need to talk about risk appetite. Yeah. We need to look about the healthcare regulatory model, where we're prepared to bend, shift. If we don't do that, creating the conditions for this to land, huge amount of energy just drives a lot of disappointment. So just remember what's the conditions we need to create together.
Brilliant, excellent. That's a great point to finish with. It's very important. I think we've picked up on the issue about people need to change, the long-term thinking, the holistic thinking, and very definitely, if we don't do it, we're not going to meet the challenges in the future and going to be worse off rather than better off. So it's not something that's going to leave us broadly the same. We will be worse off because we're in a very competitive world. We'll be left behind, and we don't want to be that, because that means we're not going to be as healthy either as a nation. So thank you very much indeed. Thanks to the panel, and thank you to the audience.